The topic for this video is mainly concerning about cardiovascular diseases, and the context that will be covered is mainly on what is cardiovascular disease, types of cardiovascular disease, symptoms of cardiovascular disease, risk factors that increases the chances of cardiovascular disease, ideal cardiovascular health, which can help decrease the chances of having cardiovascular disease. Before that, let's watch a video that could help us summarize what is cardiovascular disease. Let's talk about what is cardiovascular disease. It's the building up of plaque in the narrow coronary artery, making it hard for blood to flow through. If a blood clot forms, it can stop the blood flow. This can cause a heart attack or stroke. This picture represents the preventable death from the 5 leading causes of death. And with the 5 leading causes of death, we can see that heart disease are the top 3 causes. We can see that the region near Russia has the highest mortality rate, with more than 500 deaths per 100,000. After a brief introduction on cardiovascular diseases, let's talk about the 6 types of cardiovascular disease amongst many. The types of heart diseases that we'll be focusing on is ischemic heart disease, cerebral vascular disease, peripheral vascular disease, heart failure, rheumatic heart disease, and congenital heart disease. Ischemic heart disease is the most common type of cardiovascular disease in many industrialized countries around the world. It refers to a problem with the circulation of blood to the heart muscles. A partial blockage of one or more of the coronary arteries can result in a lack of enough oxygenated blood, thus causing symptoms such as angina and dyspnea. A complete blockage of an artery can cause damage to the tissues or heart attack. Cerebral vascular disease refers to a problem with the circulation of blood in the blood vessels of the brain. A blockage with effect lasting less than 24 hours is referred to as transient ischemic attack. A complete blockage with long-term effects is referred to as cerebral thrombosis, which is clotting or stroke. Sometimes a blood vessel in the brain can burst, resulting to long-term effect. Peripheral vascular disease affects the circulation primarily in the legs. Patients with this disease typically complain of pain in their calves, especially when walking. Heart failure occurs when the pumping action of the heart cannot provide enough blood to the rest of the body as it needed. This can happen as a result of damage to the heart muscles, for example from a heart attack or from excessive consumptions of alcohol, or because of a heart muscle disease called cardiomyopathy. Patients with heart failure usually suffers from shortness of breath and swelling of legs. Rheumatic heart disease is a major problem in many poor countries. This disease begins with a bacterial infection in childhood, affecting joints and heart valves. The heart problem appears many years later. Often the valves have to be replaced by an operation. Other infections can occur attacking the inner tissues of the heart, including the valves, and outer tissues overlining the heart. Congenital heart disease is a problem with the structure of the heart arising because of a birth defect. These anatomical defects can be as simple as a small hole in one of the inside walls of the heart, or they can be very complex, affecting the way blood flows through the heart and lungs. Some congenital heart problems result in death unless immediately corrected by surgical intervention. Some cause disability to varying degrees and are treated by surgery later in life with correction of the problem, sometimes requiring more than one operation. In this pie chart, we can see that ischemic and cerebral vascular diseases are the main cardiovascular diseases that causes death, compared to the other heart-related diseases. In this graph, we can see that the total cardiovascular disease rate is slowly decreasing between 2000 and 2010, which decreased by 31% within 10 years. Atherosclerotic is a process in which plaque builds up inside the arteries, and here are some of the symptoms. This graph represents the annual number of adults per 1,000 having diagnosed with heart attack or fatal coronary heart disease by age and sex. And as we can see that females have been gradually increasing throughout their age. In the range of 35 to 84 of age, men has been diagnosed with heart attack or fatal coronary heart disease more than females, but at the age of 85, females have been diagnosed much higher than men. The risk factors that contributes to heart disease are high cholesterol, hypertension, physical inactivity, stress, high protein, diabetes, obesity, smoking. Financial background has its equal share as being the risk factor for heart diseases because it limits us to what we eat and what our diet looks like. In these graphs, you can see the differences between a non-smoker and a smoker and how their age differs. At the age of 60, for a smoker, there is a higher chance, almost 100%, of being diagnosed with cardiovascular disease. And this graph is for the women who are non-diabetic, and it consists of both non-smokers and smokers. And as you can see, there is at least a little bit of green region, which is cardiovascular risk of below 10%, comparing to the male population as previously shown in the previous graph.
Every unhealthy heart has a cost to us all. To those that suffer, it can cost everything. Cardiovascular disease. It refers to a range of medical conditions that affect the heart and circulatory systems. It is the world's biggest killer, the cause of 30% of deaths worldwide in 2010. That's a rise of 5% since 1990. So what are the main causes? Lack of funds targeted at prevention. Too many people living unhealthy lifestyles. Not enough risk-reducing medications prescribed. Even if they are, patients often do not take them. The result is that worldwide cardiovascular disease cost over $850 billion in 2010. This figure is predicted to rise to $1 trillion by 2025. So what can be done? A healthier, active lifestyle is a start. Yet even after a heart attack or stroke, only 35% of people increase their level of exercise. Over 61% continued their unhealthy diet. And 19% continue to smoke. If patients do not follow their treatment as recommended, it can have a huge impact. Those that do, in the 4 months after leaving hospital, have up to 80% more chance of survival. But reducing the incidence of cardiovascular disease is not only down to the individual. Population-level initiatives can be highly effective. In Finland, new labeling saw many food companies reduce the salt level in products dramatically. Reducing smoking through public bans is inexpensive. Raising taxes on tobacco products both discourages and generates revenue. The fact is, doctors alone cannot cope with cardiovascular disease on the current scale. Regular checks by cardiac nurses and health workers are having a positive impact on patients' blood pressure and cholesterol. In Britain, it has reduced cardiac-related hospitalizations by 35%. Preventing cardiovascular disease is a major priority for everyone. Download the AstraZeneca-sponsored report from the Economist Intelligence Unit and find out what role you could play. The sooner you do, the sooner we can get to the heart of the matter.
This graph shows the differences between age and sex and how they actually follow the number of criteria from the ideal cardiovascular health. At the age of 60 and more, we can see in this graph, ranging from 0 to 2, it is at the highest. Male has the highest percentage in having 3 criteria met, while at the age ranging from 20 to 39, the higher percentage for 4 to 6 numbers criteria is met. The same concept is applied into this graph, but the difference is this graph is mainly about the differences between races. African Americans bearing the highest percentage of 0 numbers of criteria is met, while Mexican American has the highest percentage of having 1 to 2 criteria is met, while other races bears the highest percentage for having 3 to 6 criteria is met. Since we mentioned that high cholesterol is a risk factor, how can we minimize the consumption of cholesterol? Fatty acids are one of the components in cholesterol, and they have subdivided between SFA, MUFA, and PUFA. There are 2 classifications of SFA, which is the long chain and the short medium SFA. The long chain consists of mainly fats and margarine and butter, while the short medium SFA is of coconut oil. MUFA stands for monounsaturated fatty acid. These fatty acids are healthy types of fats. Replacing less healthy fats with unsaturated fats may offer health benefits. Consuming monounsaturated fatty acids may help lower your risk of heart diseases by improving your risk factors. MUFA may also help improve the functions of your blood vessels. And the MUFA-rich foods are olive oil, avocado, nut butter, and olives. Omega-6 fatty acids are also a type of unsaturated fat found in vegetable oil, nuts, and seeds. When eaten in a moderation and in a place of saturated fats found in meat and dairy products, omega-6 fatty acid can be very good to your heart, but too much consumption may not. Omega-3 are fatty acids that are very essential for a healthy lifestyle. These fatty acids are needed for our body to function properly and deliver some of the biggest health benefits. Since omega-3 is very rich in fish oil supplements can lower elevated triglyceride levels, which are one of the components of cholesterol. Having high level of this blood fat puts you at risk of heart diseases. To summarize what was being mentioned, long-chain SFA and omega-6 are bad for your health if not taken in a moderate consumption. And as for short-medium chain, MUFA and omega-3, they are all good for your health. But always remember, too much of something good is bad. ABC stands for avoid tobacco, be more active, and choose good nutrition. We should avoid tobacco smoking, stress, high blood pressure, and high cholesterol. And we could be more active by not being physically inactive, which we can release stress, high blood pressure, and high cholesterol, and definitely decrease the chances of being obese. Good nutrition by avoiding alcohol, which can also help with stress, high blood pressure, high cholesterol, diabetes, and obesity. And in order to have a healthy and happy heart, we should follow this healthy diet.